Understanding typhoid fever, a comprehensive overview.
Introduction of typhoid fever.
Typhoid fever is a bacterial infection caused by the bacterium Salmonella Typhi. It is a serious disease that is transmitted through contaminated food and water. Typhoid fever can cause high fever, severe headache, abdominal pain, diarrhea or constipation, and a rash. The disease can be fatal if left untreated.
Symptoms of typhoid fever.
The symptoms of typhoid fever usually appear 1 to 3 weeks after exposure to the bacteria. Early symptoms include a high fever, severe headache, and weakness. Other common symptoms include abdominal pain, diarrhea or constipation, and a rash. As the disease progresses, symptoms can become more severe, including delirium and confusion. Complications can also occur, such as intestinal bleeding and perforation of the bowel.
Diagnosis of typhoid fever.
Typhoid fever can be diagnosed through blood, urine, and stool tests. Blood tests are the most common diagnostic tool for typhoid fever, as they can detect antibodies produced by the body in response to the Salmonella Typhi bacterium. Urine and stool tests can also be used to detect the presence of the bacteria. Diagnosis can be challenging, as symptoms can be similar to other diseases such as malaria or dengue fever. Rapid diagnostic tests are also available, which can provide results in a matter of minutes.
Treatment of typhoid fever.
Typhoid fever can be treated with antibiotics, which can help to kill the Salmonella Typhi bacteria. Common antibiotics used to treat typhoid fever include ciprofloxacin, azithromycin, and ceftriaxone. Treatment usually lasts for 7 to 14 days, and patients are advised to complete the full course of antibiotics. In severe cases, hospitalization may be necessary for supportive care, such as fluids and electrolytes to prevent dehydration. Surgery may also be necessary in rare cases of complications, such as intestinal bleeding or bowel perforation. Prevention of typhoid fever. Good hygiene practices can help to prevent the spread of typhoid fever, such as washing hands regularly with soap and water. Vaccination is also an effective way to prevent typhoid fever. The typhoid vaccine is available as an injection. Oral medication. Travelers to areas with high rates of typhoid fever are advised to get vaccinated before traveling. Avoiding contaminated food and water is also important in preventing typhoid fever. This includes avoiding street food and drinking only bottled or treated water. If you have been diagnosed with typhoid fever, take precautions to avoid spreading the infection to others, such as washing hands frequently. And avoiding food preparation. Epidemiology of typhoid fever. Typhoid fever is a global health problem, with an estimated 11 to 20 million cases and 128,000 to 161,000 deaths annually. Typhoid fever is most common in developing countries with poor sanitation and hygiene practices. Asia and Africa have the highest burden of typhoid fever, with India being the country with the highest number of cases. Typhoid fever is more common in children and young adults, and is more likely to affect males than females. Travelers to areas with high rates of typhoid fever are at increased risk of contracting the disease. Estimated incidence of typhoid and paratyphoid fevers by country per 100,000 population. Complications of typhoid fever.
Typhoid fever can lead to a range of complications, particularly if left untreated. Intestinal complications can include intestinal bleeding, perforation, and inflammation, which can lead to peritonitis. Inflammation of the lining of the abdominal cavity. Other complications can include pneumonia, meningitis, inflammation of the membranes surrounding the brain and spinal cord, and kidney failure. Some patients may experience ongoing symptoms after treatment, known as post-typhoid fever syndrome, which can include fatigue, joint pain, and headaches. In rare cases, typhoid fever can be fatal, particularly in patients who are not treated promptly or who have underlying health conditions. Public health measures for the control of typhoid fever. Improving sanitation and access to clean water is the most effective way to control the spread of typhoid fever. Public health officials can monitor water quality and food safety to identify potential outbreaks of typhoid fever. Educating the public about good hygiene practices, such as washing hands regularly with soap and water, can help to prevent the spread of typhoid fever. Vaccination programs can be implemented in high-risk areas to prevent the spread of typhoid fever. Early detection and treatment of typhoid fever cases can help to prevent further spread of the disease. Here are the references from which I gathered all the information for you.